Hi, and welcome to Med for Care. I am Dr. Care, and today I'll talk to you about tinnitus, its symptoms, its causes, and its treatment. Tinnitus indicates the conscious perception of an auditory sensation to which no external stimulus corresponds. This means that the sound actually comes from our body, ear, or head. It is often described as a buzzing or whistling sound, and its intensity varies from very weak to very loud. It is defined subjective if it is not audible to other listeners, while it is considered objective if an external listener is also able to perceive it. This second case, however, occurs very rarely. It is very common disorder, mostly transient, and tends to disappear spontaneously, like after attending a rock concert. However, if persistent, it can become very debilitating for those affected. Tinnitus tones can be of various types, high-frequency ones including hissing, whistling, or ringing. Low-frequency tones, on the other hand, include hums, roars, and rumbles. Tinnitus can also present itself with mixed and variable tones or with a combination of several sounds. If tinnitus occurs as a rhythmic or pulsating sound, it is called pulsatile tinnitus. The disturbance can be constant or intermittent and can be localized to one or both ears or the center of the head, although many patients report perceiving an external point of origin. The causes of the disorder can be various. A very common cause is repeated acoustic trauma, as in the case of overly noisy workplaces. Hearing loss, ear infections, or ear canal obstructions can also be at the origin. Additionally, injuries and trauma to the head or neck can impair the inner ear, hearing nerves, or hearing-related brain functions and cause tinnitus. There are also medications known to cause tinnitus, such as non-steroidal anti-inflammatory drugs, some antibiotics, some anti-cancer drugs, diuretics, anti-malarials, and antidepressants. Less common causes include Meniere's disease, an inner ear disorder caused by abnormal pressure of the fluid within it, dysfunction of the eustachian tube, otosclerosis, inner ear muscle spasms, temporomandibular joint disorders, acoustic neuroma and other head and neck cancers, blood vessel disorders such as atherosclerosis, high blood pressure or malformations, some chronic conditions such as diabetes, thyroid problems, migraines, anemia, and autoimmune diseases such as rheumatoid arthritis and lupus. Diagnosing tinnitus involves several steps. First, it is usually the family doctor who usually performs an ear exam on the patient to detect visible changes, as in the case of a trivial plug of earwax in the ear canal. If necessary, the family doctor invites the patient to consult a specialist who will carry out the otolaryngological examination. During the medical history, the specialist collects information on the patient's clinical history and then continues with a thorough physical examination of the visible auditory system, often with the aid of an otoscope. Additional in-depth diagnostic tests and examinations may be required for evaluation. In particular, audiometric examination, head CT, and nuclear magnetic resonance are usually prescribed. It is often very difficult to trace the cause of tinnitus and remove it permanently. In these cases, however, it is possible to try to alleviate the symptoms in order to make it less disabling as possible for the patient. In particular, the guidelines for the treatment of tinnitus published by the American Academy of Otolaryngology provide for stress reduction, thanks, for example, to the use of biofeedback and measured breathing, cognitive therapy, sleep improvement, and masking. Specifically, masking sounds aim to divert attention from the internal tinnitus sound and replace it with soothing sounds. The most common strategies use, for example, the introduction of the same sound as tinnitus or an altered sound, music with the sound of the tinnitus removed, or white noise and other pleasant sounds. Although there are no drug therapies capable of eliminating tinnitus, some combinations of corticosteroids, anti-inflammatories, vasodilators, and sedatives can help manage the symptoms. If the tinnitus is due to hearing loss, the disorder can be alleviated by using a hearing aid. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon in Med for Care!